How important is the emergence of digital health? What's been the impact here in Ghana, and what aspects have, in your view, been genuinely innovative?
In Ghana, there's a lot of things to be proud about by the Ghana Health Services, in fact, and the main thing I believe is the fact that they have decided to take telemedicine as a solution to expand access to healthcare in the whole of the country. Because the country is quite large and there's not enough health services in all these remote areas. So they decided to own that model, the model we pioneered together with them in one of the regions, and they now take it on, scale it by themselves over the whole of the country.
And talking of scale, how can you be sure that your interventions here are really sustainable?
We worked with the local Ministry of Health from the beginning to make sure that the services would be integrated in the national health insurance. So it is now fully reimbursed, so patients who do access telemedicine services do not have to pay for that. That's one model that can really work. The whole staffing, for example, of all the call centers, but also the community health workers, the frontline health workers on the ground, are all staff of the Ministry of Health, which makes it sustainable by definition. It's not our staff going out doing some things.
And do you think that there's room for other partnerships to help you in your efforts to scale here?
Absolutely. Telemedicine, for example, is one of the examples where we do not have the expertise in-house on digital, for example. So we do call upon other partners like telecommunication companies or telecommunication experts or telemedicine experts to work with us on this national roadmap to bring it to scale.
What sort of obstacles have you had to overcome here, and could you give us a sense of what solutions you've implemented?
Yes, we have had several projects or pilots, if you may, that were not successful in getting to scale because we didn't build this local ownership from the beginning, or we didn't build it around the needs of the patients. You have to build all your interventions really around the reality of patients. If you know that patients cannot spend time waiting in a queue in a hospital because they have to look for a job every other day just to survive, then you have to find solutions to bring these services outside of the health system.
So you talked earlier about the need for common standards and your work with the Broadband Commission. Could you tell us a little bit about that and your sense of how digital health can soon be seen as the new normal?
There's a lot of new innovations around with good intentions, but that don't make it to scale, that seem to get stuck in the startup phase. And then you end up with a very fragmented landscape of all these applications that are not integrated into the health system. And when we realized that, we made a call in the Broadband Commission to set up a working group on digital health, and that is what we are now chairing as the Novartis Foundation with the Broadband Commission, to make sure we build the road on which these fancy applications could then drive. You need a system of standards or a system of interoperability that is there, an infrastructure or an architecture as it's called in the world of telecommunications, to make sure the interventions can all be integrated into the system. And if we don't have that infrastructure underneath, it's very difficult for standalone applications to plug into the system. That's not possible. And we hope with this policy work that we will come to a conclusion what are the best things a country can do, because there's good examples of it, like Rwanda or Costa Rica, for example, who have done this, and that other countries can learn how to approach it. And then our ambitions with digital health can really become very big and bold at that time.